Have you been told that dental implants aren't an option for you because you have too much bone loss? That may not be true. Let's discuss. I'm board-certified oral surgeon Paul Anderson from Peachtree Oral and Facial Surgery here in Peachtree City, Georgia. Today, we're addressing a very important question. Can I get dental implants if I have bone loss? This is a common concern for many patients, especially denture patients, and I'm here to give you the information you need. Let's dive in. First, let's talk about what bone loss is. When teeth are missing, the jawbone can begin to deteriorate over time due to a lack of stimulation. This is because the roots of your teeth help maintain the bone density. Without that stimulation, the bone can weaken, which can lead to further dental issues. Now here's the good news. Dental implants can actually help prevent further bone loss. When an implant is placed, it acts as a replacement root, stimulating the jawbone just like a natural tooth would. If you have bone loss, the first step is to assess your bone density through imaging, such as X-rays or CT scan. This helps us determine if there's enough bone to support an implant or if additional procedures are needed. If we find that your bone density is insufficient, don't worry, there are options available. One common solution is bone grafting, where we add bone material to the area to promote new bone growth. This can create a stable foundation for your implant. However, if the bone loss is too severe, we also specialize in both pterygoid and zygomatic implants, which utilize bone near your jaw and allows us to give many patients fixed implant teeth. Not every doctor can place these implants because it's very technique sensitive and requires specialized training. But we have been doing these types of specialized implants for a very long time, so you're in great hands. Beyond aesthetics, dental implants help maintain facial structure and prevent sunken appearance that often accompanies bone loss. They also improve chewing function, making it easier to enjoy your favorite foods. We have many success stories here at Peachtree Oral and Facial Surgery. Patients who once thought they couldn't get implants due to bone loss have achieved fantastic results after treatment. In conclusion, having bone loss almost never disqualifies you from having dental implants. With proper evaluation and the right treatment plan, you can still enjoy the benefits of this life-changing procedure. If you have more questions or would like to explore your options, I encourage you to schedule a consultation at Peachtree Oral and Facial Surgery. We're here to help you every step of the way.